Hey everyone, I'm Rachel Coyle. Like Dee said, lots of folks have attended some version of a State House training with me, which is amazing. I'm really excited that you all are doing a lobby day and that we're back to having in-person lobby days at the State House. So I'm going to walk you through some very basic details that you'll need to know, kind of get you know what the mindset is of the legislators right now, but also talk through some tips and tricks for how to be really effective on your lobby day. And then I'll come back in and answer any questions you have too. I also will send a resources email to Dee afterwards that you're welcome to share with anyone. So any links or websites that I talk about tonight, I will send them to you all afterwards. So what we're going to cover, some basics, very basics and logistics. So I'll talk you through like parking and security, that kind of thing when you get to the State House. The lobbying tips, and we'll talk through some resources for preparing. And then I'll pop back in and do Q&A. So some very, very basics. Sorry.
No. There you go.
Mute.
So that's a physical weakness. Oh yeah, look at that.
Please mute yourself if you have not, so that we don't get any. There we go. Perfect. So some basic terms to know. The first one is General Assembly, or GA. You might hear some of the staff or legislators say this term. That just lets you, it reminds you, one, it's the term for the General Assembly, but it also for the legislature, but it also refers to the 2-year period that they operate in. So the bill that you're trying to get introduced, this is the beginning of the term right now, 2023 through 2024. So the bill that you're going to get introduced would have to go through the whole State House, through the House and the Senate, and get to the governor and be signed in that 2-year period. Otherwise, no matter how far it gets, it would die and you'd have to start over again. Another term to know is session. So that's the time of year when the legislators are working, because technically it is a part-time job. And then also it is a reference to when they're physically in the State House voting on bills. And a big important fact to know this year, and right now as you're going into lobby, is that it is budget season. So the budget is going to be heavy on these legislators' minds when you're in there. That is something it's a big budget bill that they work through and they pass in just a couple of months every 2 years in the odd numbered years. So they are right in the middle of budget season right now. And that is big and important because especially of the topic that you're coming in to discuss with them, I guarantee that you are going to get questions on how you intend to pay for this bill, where, what funding source it would come from. You can see there that health, human services, and Medicaid take up a pretty significant chunk of the budget. So that, especially just because that's what they've been working on, especially these staffers have been working on every single day, is probably going to be a question that you will get asked. Another basic to know is, and Dee mentioned, not the friendliest of audiences for this bill, is that we are currently in a supermajority situation in the State House, which means that there is one party, the Republican Party in Ohio, that controls the State House with a supermajority. That means they have so many members that if Governor DeWine decided to be more moderate on something and veto it, they would have enough Republicans in both the House and the Senate to override that veto and force something into law all by themselves. So that is just something to keep in mind as you're talking to these legislators, that they are going to be trying to think through the logistics. So they may ask you, do you have Republican support? Are you talking to my Republican colleagues about this kind of bill? Because they are going to have in their head the supermajority, as they do at all times. Another thing to know this year is the setup of the leadership. So we've got in the Senate President Matt Huffman, and Nikki Antonio is the minority leader. And then in the House, Jason Stevens is the House Speaker. He and Huffman are both Republicans. And then the minority leader is Allison Russo. And one big thing to know about leadership this year is in the House, we've got some drama going on between Republicans. There's a Republican infighting issue happening at the State House this year, and it is actually creating some openings for negotiation in some bill and issue areas. So Jason Stevens is the speaker. He's a Republican. And Derek Marin, who is much farther to the right of Jason Stevens, thought he was going to be the speaker. He was elected at the end of last year. And then over the Christmas break, the Democrats and some of the more moderate Republicans worked together to basically get enough votes to elect Jason Stevens, who is slightly less far right than Marin at the beginning of this year, and that caused just a huge rift. And now Marin and several of his supporters have gotten together and just tried to cause chaos. They even made it take a few extra weeks to get the House to pass its basic rules of governing itself. They're introducing bills on their own. Derek Marin basically says that he is the leader of the Republicans because he got the most Republican votes of the two of them, even though Jason Stevens is officially the Speaker of the House with the powers of the Speaker of the House. So because of this drama, there are some bills that are moving differently than we would have expected, slower or faster than we would have expected because of this Republican infighting. So that is just a good thing to have in your mind as you're in there talking. Some logistics of actually physically getting to the State House. So parking options, there's a couple. These are my two favorites. Under the State House, there is a garage. It's a paid garage, but it is very easy to access the State House from there because it's directly underneath. And you can tell immediately as you're driving up to the State House if it's going to be open or not. Sometimes it fills up especially on big lobby days. But if the electronic sign out front that's flashing a bunch of different words, if the letters are green, you'll know that the garage is open. If the letters are red, it means that pretty soon a word is going to flash up saying the garage is full. And then from there, I always go to my second favorite option, which is the Columbus Commons garage. It's a slightly longer walk, but I have never seen it full. So that is nice. And they're both paid, but it's a pretty reasonable, couple dollars for a couple hours. So not too bad. And then another thing to know is that when you are preparing to go visit these legislators, there's going to be security. So you need to allow a few extra minutes to go through security. State House side, drive.
Okay, can you put it there so you can best it?
All right. So when you arrive, there are going to be some metal detectors that you have to go through. There are going to be, I don't think I can go back. That's unfortunate. There's going to be some metal detectors you have to go through at the State House side. There are some security guards. It's very basic in the State House itself, though, and you can ask those security guards where to go. That's literally the whole process. But going to the Rife, which is where the House members are, there's a lot more security. That is because the governor's actual official office is in the Rife. So you'll have to take even extra time to go through the State House through the Rife. So when you're going to visit those House members. And so you'll do is you'll enter from High Street, and don't worry, I'll send all this to you. Go to the front desk. You'll give them your ID. So you need to have your ID with you, and tell them which offices you're visiting, and they'll print out a sticker that has your name on it and which floors you're going to be on. And then you walk over to security and go through those metal detectors. That's the same as at the State House. And then security will likely send you up a series of escalators to the third floor, which is where all the elevators are. And there's even more security up there, and they will tell you which elevators to get on. And then you go up to your floor, and there's actually a front desk area with usually a staffer sitting at the front desk to call your legislator or their staff to come get you. So it's quite a process to get through to visit the House members, not nearly as much of a process to get to visit the senators. So just allow that extra time, those extra minutes to go through security when you go visit. And so I'm going to talk you through some preparation for your meetings, and we can talk through the meetings themselves. There's some great ways to be prepared for your meeting, including researching the legislators that you are going to be visiting in advance. So I'll walk you through some tools to do that, but you want to read their bio, you want to look up bills they've sponsored, see which committees they sit on, really just familiarize yourself with what issues they're interested in. And if you have anything in common with them, if you grew up in their hometown, or if your kids play the same sport, sometimes their bios will say those kinds of things. It really helps to be able to create just that little bit of connection with them when you go in to meet. If you're from their district, definitely say that. They'll talk to anyone, but they love especially folks from their district. And you want to try and tailor your message to things that they're interested in. So if they sit, on all these financial committees, then you know that they're going to be especially interested in, for example, how you pay for a bill like the one you all are pushing. So that is, you want to try and tailor your message to things they care about. And it just helps them to know that you have prepared for the meeting. When you are physically in the room, one thing that's really important, you're only going to get, 15 to 30 minutes, and you don't want to come in and throw all the information in the world at them. Even though we know you are passionate about this topic, there's probably a million things that they should know about this topic, but you only have that short amount of time. So you don't want to overwhelm them. You want to pick a few key talking points and really hammer those home. So the few messages that you really want them to come away with. And again, think about your audience. So if you're in there with one of the more conservative members, talk to them about all the money that Ohio would save in the long run, implementing your bill, that kind of thing. Or, you can come in with, if they've got kids, you can tell like an emotional, personal story about how kids would benefit from this bill. Just think through who your audience is and tailor your message. Data from other states is always helpful as well. And then prepare yourself for questions they might ask. So I've definitely mentioned cost. How would you implement it? Would federal help be necessary? They are definitely going to ask you if you're trying to get your bill inserted into the budget, because a lot of times most of our projects that are being funded throughout the next 2 years are going to be stuck into the budget bill. And they might ask, are you open to small incremental change heading toward your goal, or would you need to pass it all at once? And if it's totally fine if you don't know an answer, you can tell them you'll be sending a follow-up email, and you'll happily answer their question in your follow-up email. And okay, so this is a big one. I actually talked to some staffers ahead of this presentation today to ask them what are some tips they have. And the biggest one I get is that in some offices, you're going to be meeting with staff and not the legislator. And sometimes people who are coming to lobby get offended by that. They're like, oh, the legislator doesn't have time for me. But it can be really good to be meeting with staff. It can actually be better than meeting with the legislator, because the staffers are the ones who run the office. They're the ones who know all the bills, because their boss could ask them at any moment about a bill, and they have to know it. They're the ones who help shape what the office focuses on, because they're the ones doing a lot of the heavy lifting based on their boss's direction. So if you can convince this staffer that you are, worth talking to, or that your topic is really important, they're going to be the ones in their boss's ear suggesting that their boss co-sponsor this bill. So it can be really, really valuable to get that staffer on your side. They can even, if they like you, they can get you meetings with their boss. They can get you meetings with other legislators. They can get you in front of the right people. They can send you little tidbits that they hear around the state house. It's very valuable to have the staffer like you. So definitely don't be offended if you end up with a staffer instead of the legislator. Just take that time to still make your pitch. And there are some important things also to bring with you. So the first one is your ask. So what are you asking them? Dee told me that you are going to be asking them to co-sponsor your bill. So that is perfect. It's simple. It's a direct ask. You also want to leave something with them. So make sure that you have some resources about maybe a one-pager about the bill. If you have a card, like a business card or another way to leave your contact information, that is also great. And ask them for follow-up. And also let them know, friendly, obviously, but let them know that you will be following up. You'll be sending an email, you'll be checking in to see if their boss is interested in co-sponsoring, so that they know, they get the hint that they need to actually confirm whether or not they need to make up their mind about whether or not they're going to be co-sponsoring this legislation, because they know you're going to be calling back. And then bonus points, if sending a nice thank you card or note after the meeting is always just appreciated. And it also reminds them that you are there and that your issue is something that the people of Ohio care about and that you will be checking back in to see if they'll be co-sponsoring. So I want to talk you through some resources as well, and I will send this in an email afterwards so that you have all these links. But there's some really simple ways to go and research these legislators so that you have a good sense of them before you go into their office. So we've got ohiohouse.gov and ohiosenate.gov. And you can look up all the members. So you can go to members there and click all members, and you can look up individual members by their district, by their party, or by their name. So if you go, I'm going to click on the first member there, Rep. Cheryl's. Oh no, I clicked on Rep. Humphrey. And then you can see here, you can see their contact information. You can see all the most recent press releases that they've put out. So you can see what they've been focused on. Up there at the top, kind of leftish, you can see there's their biography there. You can see all the legislation that they've introduced, the committees that they sit on. Very great source of information about not only their interests, but the bills that they are focused on as well. And another way you can look them up is you can look up on the legislation search, see all of the bills that they've co-sponsored and sponsored. So I'm on legislature.ohio.gov, going to search through the legislation here. And again, I will send you all this. Once you're on the legislation search tool, you can look up by bills by primary sponsor and by co-sponsor. So you can go through and you can click the legislators that you're going to be meeting with, and you can look up their names and see which bills they have introduced primary sponsor or signed on to co-sponsor in the last couple months. If you change the General Assembly, which is the top left there, you can change it to, for example, the 134th, which is the most previous 2 years. And then you'll be able to see which bills, if they were in the State House before this term, you can see which bills they introduced in previous years as well, to just give yourself a good sense of them. And you can also look up by bill number. So if you wanted to see individual, if you know they're part of a bill that they have signed on to, you can look up by bill number as well. And another thing, okay, so this one is important for anyone who, especially if you're wanting to be able to answer some of their financial questions, or if you just have want to know more information about how Ohio is spending its money currently on healthcare. You can look up this lsc.ohio.gov. This is the Legislative Service Commission. They put out just unbelievable amounts of documentation each year during the budget. They're also the ones who write our bills, fun fact. But so if you ever want a bill introduced and you don't know how to write a bill yourself, just get a legislator to sign on and they'll get it written by LSC. But if you go to this website, you can look up, and I'm on the Budget Central tab, and I'm going to click there. So you can look up the main operating budget for the 135th General Assembly. That's the one we're in right now. And the main operating budget is going to be where most of that healthcare money is going. So you click on that and you can see there are just incredible numbers of categories of things that we are spending money on as a state. And you can look through and see how money is being appropriated and kind of get a sense for how much money is available, is currently being spent on this issue, and how that would be kind of shuffled around and changed if we were to implement your bill. And I also want to highlight, and I'll send these to you as well, that if you want to follow along with State House issues and calls to action, got lots of options here for you, how things work at the State House. We've got a list of reporters that are focused directly on Ohio and on the State House, constantly updating that list because reporters, they don't get paid very well and they get treated poorly. They leave quickly. So we are constantly updating that list, but it's very helpful to just go and click through there and see what stories they have put out in the last couple hours each day. And then also, if you want to help me pay my rent, I am now doing this as a full-time job. So this, started just recently. I'll open an LLC and would love to have your support so I can keep going, doing more of these trainings. And I will send this to you in a link as well. And now I'm going to pop back in and answer any questions you all have. All right.
I have a question.
Sure.
What's the best dress? Should we all wear our Medicare for All t-shirts or should we dress business professional?
Oh, that is a great question. If
And
you
what kind of shoes?
definitely walking shoes, especially if you're going to need to be walking over from the commons, it can be a couple blocks. And if your legislators are on different floors, there can be some extra walking. So definitely comfortable walking shoes. Do you all have the same t-shirt that's like the same color and they'll see you walking through the state house? If you do, that could be a great, just a visual for them walking through the state house, seeing how many of you there are. If not, then professional is absolutely appropriate and will make you seem like someone they can talk to. But if you have all the same shirt, that could be a really cool visual. Mom's Demand does that sometimes with their red shirts, and Planned Parenthood does it with their pink ones.
Or at least all wear the same color combo, like, a black jacket and a white blouse or something. Sure.
I see a hand raised. Marilyn?
Yeah, now do we need to have all the sponsors that we're gonna have for the bills in either house before it gets introduced?
Yes. So before the bill is, I believe it's Rep. Skindle that's introducing the bill.
Right.
And so before it's introduced, he will send out an email to all of his colleagues in the House asking for co-sponsors, and they will have to sign on before it's introduced. And then the next time they could add their name is actually if it passes the House, people get a chance to add their name if they want to. But you want as many as possible beforehand when he sends that co-sponsor request.
And if I'm correct, then Rachel, that means we won't have a bill number because the bill won't have been introduced.
Right.
But it gets assigned a number when it's introduced at that time, correct?
Yes.
Okay.
And there are several hundred in, which is interesting. But yes, so he'll send a co-sponsor request with like a very basic few bullet point breakdown of the bill, which is why it really helps if they have met with you in advance and they know what's in the bill. They know it's coming, because he won't send them. He might not even have at that point the full language of the bill. He'll just be giving them like here's why you should sign on to my bill, 3 bullet points kind of email.
Right, okay. Tim,
Oh, I don't know who got first. Yes, Tim.
yeah. Tim, go ahead.
Is there just usually one primary sponsor for a bill, or can there be more? And do we know, at this point, we don't know when our bills will be introduced. Is that correct? Exactly.
So there can be up to 2 joint sponsors on a bill. So Rep. Skindle could get one other of his colleagues. If you could get a Republican, that'd be awesome. But you might have trouble there because they rarely sign on to Democratic bills at all. But yes, he could have one if he wanted to. And Dee, do you know if he said when he plans to introduce it?
Yes, he told me that he would like to introduce it maybe 2 weeks after our lobby day.
Oh, wow.
I don't
okay.
know if that'll happen because, in the past, he'll say, I'm going to do it in such and such a month, and then it hasn't happened until later. But that was his aim, and he will send around another email after our lobby day, to all the legislators or House reps, to give them another chance to co-sponsor.
That would be great if he could do it that quickly, because then you have the argument that it could be put into the budget.
Yes. Okay, Chris.
Sort of a simple little thing maybe, but is it welcomed and legal to ask if we could have our group picture taken with a representative and then we'd send that back as a thank you?
Oh yeah, absolutely. And they love, if you are on social media, they love to post pictures of themselves with constituents. So definitely like post it on Twitter and that kind of thing too.
Yeah, we did it last time we lobbied, we took pictures.
Great. Okay, Bob Crazen.
Do legislators ever have more than one legislative aide? Are there some with more than one?
Great question. Yeah. So the House members only have one. The senators will have two. They may also have an intern in the office or an LSC fellow, which is like a paid fellow that works actually for LSC. But if the office is particularly busy, they could be staffing that office too. So there might be one or two people in the office, but they only pay one staffer in the House and two in the Senate.
And then they have other types of aides, right? Right, like I've heard some of them say a constituent aide or something like that.
Yes, that is usually going to be like often it'll be an LSC fellow who does a lot of the answering of the phones, but pretty small offices, which is good because it means if you call a lot, you can build a relationship with that same person.
Right, right. Bill's got a couple comments and a question in the chat. He's been trying to reach his GOP rep and not getting any answers. And of course, we have run into that before. And do you have any thoughts about what to do about that? To get them to at least, acknowledge your call and have a little talk about meeting with them.
That can be very frustrating because there's no requirement that they are good constituents servers. We just, push them on it. One thing I recommend a lot of the time is to go call them out about it on social media because they know, especially if you're on Twitter, because they know the reporters are on there. They don't like to be called out for being bad at talking to their constituents on social media because they know it's public. But yeah, unfortunately, the best thing you can do is keep contacting the office. Calling helps because you might get an aide rather than the legislator themselves. And if the aide likes you, you can get in a meeting with their boss eventually. But it is frustrating because you just have to know that some of them are just not going to respond.
Yeah.
Great. Thank you, Rachel.
Mm-hmm.
And then Bill had another question. Are the staffers, do they have contact information on a website somewhere?
They don't, but the staffers will, and the staffers are the ones monitoring the office email. So one of the things I'll send you in my resource email afterwards, we have a spreadsheet of all the contact information for all the offices, and the staffers will read those.
Okay. I have a question. I found a list of not all, but most of the Republicans who voted for Jason Stevens to be the speaker.
Mm-hmm.
And I thought, well, they might be a little bit more on the moderate side, or there may be some reason why they supported him over Derek Merrin. But is there a way to look at I don't know if I have all of them. I think it was something like 30 some of them voted for him, along with all the 33 Democrats. But could you just expound a little bit on the ones who didn't vote for him and voted for Merrin, and what it is, what kind of legislation? You said they're introducing bills that are just not popular with the whole Republican Party or the Republican group, I should say, or what is that?
Yeah, for sure. So it's interesting because Derek Merrin's folks tend to be, like you said, the more conservative, the more far right folks. But in order to appease them, Jason Stevens actually has been like, his list of priorities is pretty far to the right as well. The big sticking point in terms of legislation so far has been HJR 1, which is the bill that would make it way harder for Ohioans to collect signatures and pass ballot initiatives. Derek Merrin's team really wants that bill to pass. And they're the ones pushing to pass a new bill because we just got rid of August elections last year because they were expensive and unnecessary. Derek Merrin's people want to bring August elections back so that they can pass HJR 1 and then have an August election and basically stop the abortion rights amendment quickly before it gets to the ballot in November. So Merrin's people are the ones who are throwing throwing tradition to the wind and just trying as much as they can to make it really hard for citizens to pass ballot initiatives to stop the abortion amendment at any cost. And Stevens people are more like, you know, we just got rid of August elections 4 months ago because they're super expensive. And I don't love the idea of stopping Ohioans necessarily from participating in the process. So like maybe we should talk this through and have hearings. Not necessarily that he's not going to be supportive of HJR 1, but that he wants it to have its time in the sun. And so that is a big fight right now between the two caucuses. Other than that, sadly, the Marin people have been getting a lot of like their anti-trans bills. They've been getting those introduced and listed as priorities, that kind of thing. And all the attacks on education have been the same. It's really just more like Stevens values the process a little bit more, and Derek Marin is willing to throw it all away to get what he wants.
Okay, that's interesting. And
My understanding is that Stevens is trying to drag it out to kill the time so they can't do it in August. Have you heard anything to that effect?
Yes, we've heard that for sure. And because he doesn't want it to move as fast, the Marin people are actually trying to do something, a very, very procedural move, but they've been basically trying to discharge the bill out of committee and put it directly on the floor by collecting a bunch of signatures of their colleagues so that Stevens would lose his power to keep it in committee and they would force a vote themselves. I don't think they have enough votes to do that, but that has caused a big fight just in the last couple of days, is them trying to basically take over HJR 1 all by themselves.
And I understand that one of the things we need to do is call Stevens and tell him to more or less keep dragging feet.
Yes, absolutely. And one of the big things to bring up is the reason they got rid of August elections last year was because they cost so much money, and it would cost $20 million for taxpayers to bring them back. And so just like letting him know that that is very helpful, because it'll give him hopefully it'll keep his backbone there, and so he can stand up to the Marin people.
And one more related question before we get to some other questions is, who decides whether there is an August election or another, a separate election? Is that something that the whole House has to vote on, or the Senate, or what?
Yeah, because we got rid of them, they would have to pass another bill
Okay.
to bring them back. And there's a bill in the Senate, SB 92, to bring back August elections, even though they literally passed the bill to get rid of them in December. Yeah, so they'd have to pass a whole nother bill, and then they would have to pass their HJR 1 and then set an August election. Yeah.
Okay. Yeah. Okay. Bob Parker has a question.
Well, actually, I have a comment, and that is, I don't think there's any way that we're going to get any Republicans in this session to back this. But if we're talking to people, to legislators, we could point out that conservatives everywhere else do not oppose national health care. Canada, Europe, Japan. Some of them like to tweak it and are attacking it in various indirect ways, but none of them have a frontal assault saying, we want an American-style healthcare system. So everywhere, conservatives are in general on board with national health care.
Yeah, absolutely. Bringing up, and are there other states that have implemented something similar to this? I was wondering that could be an argument to make.
No other state has gotten to the goal line, but there are several states, about 20 other states, that have an organization like ours. And some of them are a lot closer than we are. So,
Rachel, first of all, thanks for doing this. I really appreciate the overview, and it reminds me of everything going on. I'll tell you. The question I have is kind of a weird one. Is there any woke energy in Ohio? It seems to have taken place a lot in Florida. I don't even know what woke is, but I sense that the education bills and the gay bills and all that kind of stuff is part of that. Is that terminology at all being used in the State House?
Yes, the far right Republicans, actually a lot of the Republicans are using that woke language all the time now. And that is a lot of the bills that we are seeing in states like Florida and Texas are also in Ohio State House. They just passed a bill, like they're in Texas, they're taking over the elected school boards, for example. Ohio is trying to do that exact same thing. They've got a bill in Ohio that they've also got in Florida that would allow them to really, I mean, devastate our colleges and universities. It would ban entire departments and majors and topics having to do with diversity and culture and different groups of people in Ohio's colleges and universities. Then the whole reason that they give for that is that they have to fight back against woke culture. I don't really know what woke means either, because nobody does. It's just a trigger word now. But if some of these bills pass, our education system is going to be in big trouble in the same way that states like Florida's are, but we somehow aren't getting the same national coverage, and it's very frustrating.
Well,
Oh, I saw it. Sorry, go ahead.
yeah, go ahead, Rachel, go ahead.
Someone in the chat asked if the bills are coming from ALEC, and yes, there's definitely it's not just ALEC now. There's actually more organizations, which is lovely. But these bills are absolutely being fed to states all across the country with very, very similar language. You can actually look up some of the language from some of these education-related bills on Google, and it'll bring up multiple states because they've introduced pretty much the same thing.
Yeah.
Troubling, very troubling.
Kendall, go ahead.
Yeah, I met Rachel several years ago down in Cincinnati when she was traveling the whole state. And she was needing money for gas back then. And I would like to reinforce to, because she's out on her own now, for people to send her some money, but we got to find out, how do we get the money to you?
Oh, thank you. Yes, I just started this as an LLC, and I'm pretty much planning to do it until I run out of money, and then I have to get a real job. So we'll see how that goes. But I have a donation link that I can put in the chat. I'll also email it to you. I would
Yeah,
very much appreciate that. Or if you use Venmo, you can do that as well.
Can we call a quick span meeting and make a motion?
Well, we can do that with NJ. We can bring that up with him and you know.
I think we should put Rachel on retainer.
There you go.
I would do it. Actually, I'm on retainer with a voting rights group, and every couple weeks I come in and give them updates on voting rights bills, which has been really fun.
Yes.
Great.
I think they're coming into Ohio.
I wish you well.
They're here in Ohio now. Voting rights.
Okay, Chris.
I agree. Let's talk about doing something more with Rachel.
We
at an official
definitely
meeting.
will. We definitely will.
Thanks so much.
Yeah,
I'm honored. Thank you.
yes.
Got to keep you going.
Yeah, my parents were pretty nervous when I was like, I'm quitting my job and starting a business. And they're like, okay, let us know.
Well, I take it you're not with Innovation Ohio anymore.
Yes, and Innovation Ohio is wonderful. I just, it was time to start seeing if I could do the State House thing full time. And now I have more time to do the more trainings. I'm going to start one that's budget specific, for example, and one that's specifically about how to testify. With timing, I wasn't able to do as much before. So we'll see how this goes.
But if we get this through, we probably have to have some proponent testimony training.
Yeah, happy to.
Yeah, if we get to that point again.
Yeah.
He's introduced this before, is that correct?
Right.
Did he get proponent testimony for it last time?
We did in 2018 before the pandemic.
2 days worth.
And
Wow.
yeah, that was the only time it's ever gone any further than just, introducing the bill.
Mm-hmm.
Well, and everyone else, I'm hoping that this is just the first of maybe multiple lobby days. I don't think that, one shot is going to get everybody on board that we're going to need. There's lots of follow-up. So Rachel, I'd like to go to your budgeting training. All of these are very exciting, very interesting. and worth paying for.
Yes.
Yeah, it will not be this is not the first lobby day. I don't know how many have been done in the past, but I know I've been at, I think, 2 of them. Of course, we didn't do it during the pandemic, but I don't know how far back it goes. Maybe some of the older members can answer to that. Anybody know? Okay, all right, Tim, Bruce?
Yes. D, do you advise regions to set up planning meeting for the people who are going to be attending ahead of time so that we can,
Yeah, I think
come up with a plan of action?
I think that's a great idea. I think Kathy, was it you that said you were going to do that? And I thought that was a great idea. I wish it had been mine, but I didn't think of it at first, but certainly I think that's very good because you need to figure out, if you have, let's say, 5 people in a group, who's the group leader? I started with the concept of a group leader, and that person probably would be the one to say, this is who SPAN is, this is what we're working for, and just a little bit about why we're working for it, and then other people can give another viewpoint, say if they're a small business owner or they're just, or whatever, their experiences in life have been, can give their viewpoint, and maybe 1 or 2 people can give a personal story on healthcare. So yes, to answer your question, I think it's a great idea to do that.
Okay. All right. Thank you.
Yeah. Okay. Chot.
Yeah, Rachel, do you think it's more efficient to come in with a bunch of statistics or some kind of story? I mean, I've heard some people say if you give a presentation, you shouldn't have more than a few slides because it just puts people to sleep. But at the same time, we were on a call like 6 months ago, and this person said, if you have cystic fibrosis, you will live 10 years longer in Canada than you do in the United States. So do you have a feeling on which is better, the stories or the statistics?
So that's a great question. And obviously part of the answer is going to be it differs person to person, office to office, but you're absolutely right that too many statistics, you're going to get lost in the sauce. They're going to get bored or they're going to get overwhelmed. If you can come in with an emotional story and 1 or 2 statistics, both like together, those things could be really memorable. They could remember the story of a real person, maybe even a person in the room, but also like that one stat that you just mentioned is very powerful. But come in with 1 or 2 things that you want to make sure you say, instead of trying to throw all the data from all the other states or countries at them at the same time, could be really valuable. It is. And then they'll probably have follow-up questions that are more detailed, like how it would be paid for, where in the budget it would go, that kind of thing. But starting off by trying to throw all the data at them at once is the only way I'd say that you'll lose them.
Right.
Think.
Okay. Let's see. Amber, you got your hand up?
Yeah, I just wanted to speak a little bit to what Tim said, because Region 7, we don't have our own team because I'm not leading a team. So it was my understanding that D, we're going to kind of put us all on a separate team. So I don't, because we all have, there's different leaders. So we can all meet as a region to talk, but it might be more beneficial to talk with team leaders in their own individual team, like Bob or Arlene, or wherever you ended up putting us, D, because if Lynn comes, that'll be 4 or 5 of us that are coming from Region 7 that could be placed wherever.
Yeah, thanks for bringing that up, because I don't know if NJ would like to be maybe the group leader. I haven't talked to him about that yet, but I will get that figured out and let you guys know, and you can maybe let's see, I'll figure it out, because I'm still getting people added on that want to come in and lobby, which is great. We've got probably 35 or 40 people now, and so I'm going to start dividing up people into groups and work on that. So thanks for bringing that up, Amber, and I'll get back to you on that, you and Tim and NJ.
Yeah, that sounds great. Yeah.
And Bill Davis. Bill's been around the
Yeah, Bill's good too.
block a few times with us, so. All right. Tim, do you still have your hand up? Did you want to?
Oh, no,
Something
no,
else?
sorry.
Okay, that's all
Sorry.
right. That's okay. Kendall.
Yeah, I was wondering if you had each team assigned to a legislator yet, so that we can know who to look up the bio on and stuff like that ahead of time.
Yeah, no, not precisely, but I have been asking each region to look up, and I've sent out to all the regions, and I haven't sent ours out for Region 4 because, we, I just haven't. But anyway, each region, I've sent out the list of legislators that we have appointments with, and also the ones that we have requested appointments with, so that you can start looking at their bios, excuse me, their bios, and the legislation that they have introduced or co-sponsored in the past, and see what their interests are. And to that point, I have another question for you, Rachel. At some other talk that I heard, it was mentioned that we should look at the district that legislator is from and try to get specific information about that area, those counties. And I'm not sure exactly how to do that. But I think that could be effective. There's a statistic out there that there's a 29-year life expectancy difference just in the state of Ohio, from one county to another, from a poor county to a rich county. And that would be sort of some great information to have. Do you have any thoughts or ideas about that?
Looking up what their district encompasses, you mean, or
in terms of health
right
outcomes, and in terms of health outcomes like that, like life expectancy and
that is a good question. Yeah, you'd have to look at, I don't think that's available on like the legislature website. I wonder if the state has data about that, though. Annoyingly, several of the state websites are down right now, but I will look it up and add anything I find to the resources email I send afterwards.
Okay.
There may be some information by county government about that. I know the city of Columbus has something just under 30 years difference in life expectancy between zip codes, and that may be where where that data would show up, is in county government.
Yeah, that's what I was thinking, because Brad has some information about that. The Bread organization had some information about the differences between life expectancies in one area versus another.
Okay. So that would be helpful, Rachel, if you have any other ideas that you can send. And also, if you guys can just look up county governments and see if you can get any health statistics on your legislators' area. So
I know Ohio overall ranks poorly, but I'll have to check and see if there's things. There probably are, at least like Northeast Ohio versus Southeast kind of thing. Yeah.
Might be through the public health department.
Mm-hmm.
Might have stats on that stuff.
Good idea.
I put a website in the chat. Health Policy Ohio has a good source of information.
The Health Policy Institute?
healthpolicyohio.org.
Oh, okay. Okay.
It's in the chat.
Okay. And let's see, Arlene says there's a huge disparity in Franklin County. Yeah, the one I saw, it was a rural county up in the Northeast area. And then it was compared to, that was where the life expectancy was 60 years. And then it was compared to somewhere down, I don't know if it was Cincinnati area here or Columbus area, but it was 89 years. So there's a huge disparity. So And Bill Davis, you've got a note in there, Montgomery County ranks 80 over 88 in health quality. Where'd you get that? And what does that
Well,
mean?
there's 88 counties.
Oh, okay.
Last time I looked, Montgomery County ranked 80th. And they had some of the worst maternal and infant mortality.
Okay.
Where
did you get that information?
I don't remember, but it's probably out of Health Policy Institute, or it might have been on
Yeah,
the
I think it is, Bill,
Public Health.
because I seem to remember seeing that. It's the same thing where they rated Ohio so low in terms of what was it, 47 out of 50 states.
Yeah.
Yeah, depending on where you look and what year you're looking at, Ohio's been floating up and down between the border of the bottom of the 4th quintile and the top of the 5th quintile nationwide.
Mhm.
You might get different stats, for different things based on, like the different organizations that, like infant child organization versus elder care and stuff like that.
So that could take a lot of research, but if any of you can do it, even a little bit, it can be helpful.
Well, if it doesn't get done in time for the 19th, if we get the proponent testimony, we can use it then.
True. So I guess the biggest thing too that I ask everybody I know who's very experienced with lobbying, and Rachel, I'll ask you, we get when we talk to Democrats, most of them are pretty respectful and listen, and many are very enthusiastic, not all, but many. But when we talk to Republicans, it's just the opposite. I might hear one or two that say, oh, it sounds like a great idea, but I just don't know how we could do it, financially and so on.
Mhm.
But the ones who really don't, are just dead set against it, bring up the same tired points, which are first the financial part of it.
Mhm.
And secondly, what I hear a lot is people need to take responsibility for their own health care. They need to quit eating fast food, and they need to exercise and, not be overweight and so on. And they need to get a job so they would have health care. And so you just kind of can't knock any sense into them about the fact that not every place of employment offers insurance, and the people are sometimes, are many people who are self-employed can't afford to have insurance. They're having trouble with finding affordable plans and so on. So how can we effectively counter those same tired arguments that we hear?
Interestingly, the argument that I make now is based on my own personal experience, which is Republicans in Ohio are constantly talking about how we need small business owners. We need people to strike out on their own and be entrepreneurs and start a small business. Like, we want everyone to form an LLC. And I am doing that. I am doing exactly what Republicans want. I started a small business, and it is terrifying out here because I cannot afford healthcare. You lose Medicaid very, very quickly if you hit just a very, very small financial level. And then the healthcare plans on the marketplace are very scary expensive. And so there is a punishment to doing what Republicans want and starting a small business and being a small business owner that would be fixed by everyone having the ability to know that they will be able to go to a doctor. So that actually is an argument that I now make just very recently out of having experienced it, but playing into the things that they're always saying and reminding them that small business owners and elderly folks who may not be able to go out and get a job, who are also often their voters. You know, it really is playing into what they think about. But it is, you're absolutely still going to come across those folks who just cannot be convinced.
Can we use your story as a healthcare horror story that we can?
Sure. Yeah, go for it.
Okay.
Say,
Yeah.
Rachel, have you ever seen our economic impact study?
no, I don't think so.
It states in there that if this plan went into effect, there was more businesses would come into Ohio because they don't have to deal with the healthcare.
Yep, absolutely.
I think, was it 18 or 19 is when it was done, and it would put $2,300 more spendable cash in I think it's a family's pocket. You spendable cash goes went into effect. That's back a few years ago. So,
And I'm sure, I mean, taxpayers would be paying less on emergency room bills that don't get covered because people wouldn't be waiting until it's emergency room levels of bad to go in and see someone.
I got another question too. Do you think there's anybody in the Senate that would be interested in being a sponsor for the Senate bill?
It's rough going in the Senate. They are down to 7 Democrats at this point. Let me pull up. I'm sure you could get one of the Democrats to introduce it.
Well, I'm thinking Bill DeMora.
Yeah, he would be a fun one to talk to.
Yes.
Yeah, I've kind of communicated with him about it and stuff like that. I kind of teased him with it. So,
Oh, interesting. Did he show interest?
the first time he said he had, being new, he had too much going on right now to think about it. But last time that he seemed more interested. I don't know, Dee, did you call him yet or?
Not yet, but we're going to. We lost our Teresa Feder was our, universal healthcare champion, and we, lost her from the Senate. So we have met with one senator, another senator's aide, and they were not, at least the one said he was not willing to be the primary sponsor. But yeah, we're going to try to, definitely want to talk to Bill DeMora.
I don't know some of the new ones as well. I'd have to look through the list.
Yeah.
But it's rough times over there right now.
Yeah.
Well, I'm just going by Bill DeMora's history.
Mm-hmm.
Yeah. Well, he seems like the best shot, although some of the ones that have been there for a while have been pretty progressive. So we'll reach out to all of them. But right now we're just concentrating on the House because we know that we have Mike Skindle.
Mm-hmm.
So any other questions, discussion? Okay, well, we can, if everybody wants to stay on, we can discuss a little bit more about Lobby Day. I'm getting a few questions on the chat and I can go over that more if you'd like to stay on. And Rachel, you're absolutely welcome to stay with us because we can, we may come up with some other thoughts or questions for you. But I thought we might have a little bit of time at the end to go over things. How does that sound to everybody? Want to stay on for a few more minutes?
Sure.
Okay. All right.
Okay.
And I just want to thank you, Rachel, for so much for when I emailed you out of the blue. I don't think you knew who I was, but I knew who you were. And you responded right away, and I appreciate that. And it's been very valuable to hear what you have to say. And many of your other presentations have been valuable as well. So
thank you for having me, and thank you all for paying attention to the State House. Sometimes it feels like I'm just screaming into the wind, so I appreciate all of you.
Yeah, I've been following that. I'm gonna follow you. I know what's going on.
That is comforting.
yes,
Keep up the good work.
yes, keep it up.
Thanks, Rachel.
All right, so Arlene put in a question where and when we meet on the 19th, and I put that in there. The Rife Center, room 1932. It opens at 8:30. So you can come in right at that time, and we want to meet up at that, in that room on the 19th floor by 8:45. And Mike Skindle is going to speak with us at that time. So, and then you've had other questions about, I do think it's a great idea for each group to get together and plan, you know. I want you to know that I'm going to try to have you, of course, meet with the reps that are in your region. You're going to be more familiar with them and so on, but you may be meeting with reps that are not in your region because, for example, in region 5, which is the whole Columbus area, we have like a whole bunch of people that wanted to schedule it right at 10 o'clock. And so, you know, other people are going to have to take some of those meetings, other people, you know, of our group. And then, so there will be a mixture of people, but I'm going to try to get all that sorted out in the next week and send it out to the group leaders. And the coordinators, I should say. So.
One of the things I thought about, some of us are going up the night before, and I just wondered, Rachel, are you staying in Columbus or are you back home?
I live in Columbus now.
Okay. I thought maybe if you had time, maybe you could stop by. We're staying in one of the motels close by. I can't think of the name of it. Depot.
Yes.
Yeah, for sure.
Yeah.
But you know, like Friday night.
Yeah, a bunch of us are going from different areas. If you want to meet us there, Kathy put something in the chat, but then I think she got off the meeting. Do we want to meet for dinner? And I think that would be great around maybe 6:30 or 7. And it's the double suites. Chris, help me out with the name of it. Double suites.
A double tree?
No, you're muted, Chris. Double tree suites, that's it, I think.
I'm sorry, I put it in the chat. We're staying at Doubletree.
Yeah, it's on.
And they are suites, so
Right.
you can put more than one person in a room. So that saves a lot of money.
Yeah, it's a bedroom plus a living room that has a couch that serves as a bed, so you can at least have 2 people in each room and split the cost. It's double suites by Hilton, or no, Doubletree Suites by Hilton, and it's at 50 Front Street, which is very close to the State House, 2 blocks away or something like that.
Looks like Bob Ream has his hand up.
Oh, yes, I'm sorry, Bob.
Yeah, sorry, I couldn't join right on time. I was meeting with Quakers, and then my computer, the normal computer, had to be restarted, and it took me 15 minutes to log on. So I'm finally. My question is that room 1932 sounds like where we're going to first meet, but that will not be our headquarters throughout the day because we'll be leaving there. I can't imagine that'll be our place to meet the whole day.
It will. It will be. I mean,
Oh, really? Okay.
Yes. I mean, you can go back to that room between meetings, although you'll only have about 15 minutes between meetings. But if for some reason you have a longer break than that, you can go back there. And
I've done a lot of different lobby days, and historically that location has been somewhere in the State House, not in the Rife Center. So this was a different pattern from what I'm used to.
yeah, this is in the Rife Center. And we will also meet there at 2:30 in the afternoon to sort of discuss our day and debrief, so to speak. So that's the plan. At 8:30 to hear Mike Skindle and to have coffee and donuts or bagels or something like that, and then start out. The meetings start. There are 3 meetings scheduled at 9:15 so far. So some of us will have to scoot out the door pretty quick and get going, but most of them start at 10. And
Are these also state representatives only, or are there any senators involved?
Just state reps, because
So we won't have to cross back and forth.
no, because we don't have any. We don't have a senator that's prepared to sponsor the bill right now. So
Okay.
you know, if we get one, maybe we'll do another lobby day, you know, and hit all the senators. But it's just not, there's no reason, I mean, there could be some reason to do it, but there's, I think with 99 reps, I have about 25 scheduled so far. I want to get double that. I don't think we're going to get double that, but I'd like to get up to 35 or 40. And I have lots and lots of calls out there and emails out there. So we're going to probably hit, 35, I would say, at least. And that's, we want to reach the new people, especially new gems, but all the new people, because we need to educate them and inform.
Mhm.
So that's our first mission, to inform and educate. And then if we get enthusiasm from somebody, okay, could you co-sponsor this bill? It's a serious bill, it's not pie in the sky. We could do this. So.
How do you politely ask some of the GOP members, why do you think we're the only country that doesn't have universal health care?
33 out of 34's got it.
I think you could ask it just like that. That's polite enough for me.
Yeah.
Rita, or no, Jenny, sorry. You're muted.
Yes, thank you. I am embarrassed to say that I am not familiar with this bill yet, and I would like to be able to catch up to all of you and get a little bit more familiar. I'm an experienced lobbyist, but I'm not sure what you're doing. So is there some resource for that?
Yes, you can. I don't know if I have your email. What area are you from, Jenny?
I could ask Bob Crazen. He probably would. I think he's hopped off.
Okay, yeah, ask him. I sent out the Legislative Services Commission, like a summary of the bill to all the members of the lobbying committee, and he should have it. And he
Okay, great.
Alice Farina is very familiar with it too.
Yeah.
Okay, great. Thanks.
It's not an easy read, but the Legislative Services
The summary is
easier.
easier to read. Don't try to read all of it.
Yeah. And you can at least, hit the high points and understand the bill. So
You should be able to find the legislation by going to the SPAN website. I put a link in the chat.
Yeah, it's House Bill 446 last year.
So Lynn, Lynn is asking in the chat what the bill number is. The House Bill 446 was from the previous legislative session or General Assembly. We don't have a bill number for this General Assembly yet. Not until it's introduced.
They're all going to be similar. It'll give you a good start on where we're at.
It's going to be the same bill. I mean, Mike Skindle told me it's basically going to be the same bill.
And the SPAN website also has something there somewhere that has talking points for legislators.
If I remember right, underneath resources, it'll have the economic impact and the House Bill 446, if I remember right.
Well, the House bill is under legislation.
Oh, it is on there? Okay.
Yeah. So, okay. And, reach out to Bob Crazen if you have any other questions, or Arlene or Alice, have both been very,
Okay. Thank you very much.
Okay. Any other questions, ideas?
Yeah, I said Friday night. It's going to be a Tuesday night, not a Friday night.
Yeah, it's Tuesday night.
Yeah, I've been getting my days mixed up.
It happens to all of us at a certain age.
Yeah, I told somebody Saturday we might have a meeting the next day, which I thought was Monday, and come find out wrong. So, been doing a lot of that.
Yeah. Okay.
Are most people staying in Columbus the previous night?
I'd say about half of us are, not most. A lot of people are driving that morning.
Okay, all right. Just one
But
vote.
if you're interested in doing that, Tim, just email me. I can send you the information. I've sent it out, but nobody in your region is on the lobbying committee except for NJ, but he's too busy. He hasn't been able to attend.
I
Got a busy job.
Well, Tim, I think we'd have to leave about 7:15 to,
Well, I mean, it's doable. We can do that.
yeah.
Yeah,
Yeah, yeah.
figure out how to carpool with
We need to figure out a carpool for our group.
Well, I
If it's just 5 of us, then we can all fit in one car.
Yeah,
It might be 6 because NJ said he was gonna check with Sue Sutton
Oh, yes, and
and do you have any other people in your region that you think would
and
be?
Lynn Grubb, the one who talked first, she might come. Is that right?
That's me.
Yeah.
There's another hand up there, Dee.
Oh, thank you, Linda. Thank
I
you.
just wanted to ask if we're gonna plan to stay at the DoubleTree, what's the rate? Do you know?
Well, it was 155 a night, but I don't know if they will still give you that rate because we were supposed to ask for that by the end of March. And so they may not, but but ask them, tell them you're from SPAN, tell them that you're from a group called SPAN, and we had a group of 10 rooms that were supposed to be just for us, and ask them if you can still get that rate.
If you're military, you get AAA or senior citizens, they'll give you a discount, because I used the military and I got it for somewhere between 140 to 150 for one night.
Yeah, and our rate, I believe, was 122, but that's without tax. You get to 150 with tax.
Yeah.
So when you're comparing to another hotel, make sure you check the tax because it's pretty high.
Thank you.
I think Linda, Kathy Caraway was gonna have a group of people staying over, and so you could check with her and see if everybody has a roommate, because they may have a couple rooms and may not have it, 2 in each room. And Bob Parker, Bob was not gonna stay overnight though, I think. Didn't you tell me that, Bob?
I think Bob's planning to drive in that morning.
Yeah.
Carpooling with him is an option too. So we're gonna follow it up, I think.
Yep. Okay. All right, well.
Parking is
What's your
expensive,
consensus,
too.
Dee? Do you want us to dress professionally or t-shirts? I heard the question asked before, but what's your?
Well, we never really voted on that. My thought was to dress professionally, and I do have some healthcare buttons available for people to wear. But if, we can, it's not everybody here, so I guess we'll just have to decide on our own, whichever you'd rather do. I think, the t-shirts are absolutely fine. So whatever people want to do, I think is okay. I guess we could have taken a vote at our last meeting, but we didn't do that.
I'll wear my t-shirt under a suit coat.
All right, that works. Well, when we did the sponsor proponent testimony in the House, it was in the Insurance Committee, the House Insurance Committee 4 years ago. A lot of people, a lot of the health professionals wore their lab coats, which was kind of a good idea to show that, there are a lot of health professionals that support the bill. So that's a thought too, people that are in healthcare could do that. But I'll leave it up to you all. I'll just mention this. I looked at Moms Demand Action. They had an advocacy day last month. And they had, I think, something like 50 or 60 lobbyists there. And they met with 70 legislators. And I said, oh my gosh, they're putting us to shame. But they do have a much bigger group than we do. But it's something for us to aspire to.
Which group is that?
Moms Demand Action.
Ah,
Yeah.
speaking of dress, I lobbied recently with the Hunger Network in Ohio for funding for various hunger related issues. And a lot of us, but not all of us, were clergy. We were asked to wear clerical garb. I'm a Quaker, so we don't really have that kind of garb, but there were people wearing the dark collars or the white collars and all that.
That's a thought too.
It's kind of fun. But the lab coats, certainly, I mean, I'm not a health professional, so wearing a lab coat would be misleading, but
yeah, we could all wear lab coats. No, but yeah, and I think, yeah.
We can go as poor people, you know, just holes in our pants and stuff like that. You know, you need healthcare.
Well, okay, everybody. I guess get together with your individual groups and your regions. And if you have questions, call me anytime or email. I'm on the phone almost all day, except for the days that I babysit, and then I don't answer the phone usually, but I will get back to you. And that's 3 days a week. But I'm looking forward to this. I think it's going to be, a successful lobby day. I think we're going to do a lot of educating and informing, and that's what we need to do.
Yeah,
So,
the last time we done, we found out there's a lot of people didn't know anything about the bill, that there was a bill.
yes, yes. So that's what we're going to do. We're going to let them know that we are here. We've talked to several, even Democrats that weren't aware of the bill, and some were very happy to know that there was such a group in Ohio that was working on this issue, because they know that how important it is. So I'm looking forward to it, and I will see you on the 19th. But we can talk anytime before that. And thanks again, Rachel.
Yeah, thanks a lot.
Okay.
Don't
Thank
forget
you,
to write the
yeah.
checks.
Thank you, everyone. Have a good one.
Okay, thank you.
Okay. Bye-bye.
Bye.
see you later.
Bye.
Good night.